COVID-19 has struck us like a tsunami. Within weeks, it triggered a crisis response from our health system. It tested our community's resilience and our safety net, and it thrust thousands into poverty. On so many fronts, we rose to the challenge and did things that were considered impossible just months ago. Things like free childcare, raising the amount of New Start, remote learning, a housing-first approach to rough sleeping, and remote medical appointments, including mental health consultations. Things that we thought would take 10 years took 10 days. COVID-19 upended our understanding of what was possible. We should celebrate and protect those advances, embedding them as standard practice going forward. And I'll speak in more detail about some of those measures shortly. But we must also acknowledge that COVID-19 has exposed some significant fragility in our system. Vulnerable people are always hit the hardest in an emergency or a disaster, and so it is in this pandemic. They're the most likely to get sick, the most likely to lose their jobs, and the most likely to be evicted from their homes. And they have the least ability to absorb the income hit when their hours are cut, or they go out and need to buy a new iPad when the kids are learning from home. VCOSS applauds the speed with which governments have scrambled to respond to the social impacts of this disaster. But at the same time, that speed and that scramble underlines how threadbare some of our social protections were. Our safety net was revealed as riddled with holes. Holes that too many people were slipping through. For example, international students who are not eligible for Medicare, casual workers in insecure jobs who don't get the wage subsidy, people without homes who can't safely isolate. So it was community organisations that stepped up, as they always do, and worked with the government to support communities and vulnerable people in their time of need. Despite restrictions now easing, we know that this is far from over, that hard times lie ahead. And as people start moving back into the world, it's again the most vulnerable who are the most at risk. For example, people who are older, those who have a disability, or those with a chronic illness. It is these people who will need to remain the most vigilant and will potentially be the most isolated. Loneliness, disconnectedness and anxiety will likely be their constant companions. And as VCOSS sees it, the Victorian Government has two broad challenges going forward. Firstly, to combat the public health emergency and to keep Victorians safe and well. We are not public health experts, so we will not seek to advise the government on this front, except to say vulnerable communities must be front and centre in this health approach. Nobody should be missing out on proper care because of who they are, where they live or how much they earn. Nobody should be missing out on online services because they don't have the internet at home. Nobody should be turned away from mental health care because they aren't considered quite sick enough. And nobody should be confused about where to get help because English is not their first language. Nobody can be left behind. The second challenge is making sure that our recovery is fair, inclusive and smart. Our recovery must be about more than getting spending down and GDP up. Our recovery must be about tangible outcomes for real people. The smartest way to embed this approach would be for Victoria to become a wellbeing economy and to deliver a wellbeing budget. A wellbeing budgeting approach would allow for us to draw a line under the pandemic and to set ambitious goals for our recovery. For example, how many homeless people do we want to support into stable housing and by what date? And how many kids have disengaged from school during the pandemic? How do we plan to get those kids back into learning and engage with their school community? These types of social goals and measures should be in the budget papers alongside economic indicators like inflation or net debt. Only by embracing a wellbeing economy will we have a fair, inclusive and a smart recovery. Now is absolutely the time to think big, to be bold and to take the smart steps required to deliver real change. Here's one example. There is a way the Victorian Government can fight inequality, create jobs and stimulate the economy at the same time. 2 words, social housing. A large-scale social housing construction blitz would create homes for people in need, meaning that they can get their lives on track, look after their health and in some cases find work. But a social housing construction blitz would also create work for tradies, for architects, for engineers, for truck drivers, for material suppliers, and the list goes on. The government, I note, has made some very initial investments in this space earlier this week, and these investments are very welcome. Every new home means one less person, one less couple, one less family who is no longer homeless. But so much more is needed. And the more we do, the more lives we change. The more we do, the more jobs that we create. The more we do, the more stimulus we give the economy. And as I said earlier, this pandemic has upended our understanding of what was possible. And that's only half true, because it's also revealed that we decide what is possible. Something is only possible if we say that it is. So my final plea to this committee, to the Parliament and to the government is simple. Think big, be bold and hold your nerve. Thank you.
Thank you, and I'll invite